Welcome back to SIROWORLD 2016. I'm sitting here with a couple of rock stars. I'm just going to call it that, in the SICAT world. You know what I'm saying? It's good to see Dr. J. Reznick back again and Dr. Javier Vasquez.
Good morning again.
And we're talking about, well, you're the rock star pioneer in this space. That's what you said. No, I'm kidding. What are you most excited about with the SICAT function software? Let's just start there, and we can go back and forth all day long.
Yeah, I think the potential that we have to be able to see the body internally, how it works, that it will change many concepts that were dogmas, that we believe how the body functions, because most of the studies, they were made in cadavers. We know muscle function with the need to manipulate the jaws to create that part of movement, and most people are still doing it. And having a machine right now that we can see how the body functions, the internal joints, when, like, are we talking? Mm-hmm. Like when I'm laughing, when I'm eating. And all these activities that are also involved with the sleep patterns, when I lean the patient back and I see how much that jaw will move back, that gives me the fact that I can treat every patient independently. I think it's not a cooking book to treat patients. I think a good physician complete of the training and pick which tools they're going to use and how they're going to use it in the patient, because every patient has different conditions and need to be treated differently. Of course, we have some principles, but this machine allows and helps us to capture that information that is unique. It's a fingerprint for that particular patient, and if I can collect those movements and save it in a computer and reanalyze that data, I will have the full time to make an analysis when I'm going to start treating that patient. So that's fascinating to me.
I love that. When we were talking during the break, Dr. Reznick, you were talking about your TMJ work, and what do you find are some of the benefits in that space, for instance?
Well, I think we have to, we've come to realize that our patients are dynamic 3D people. They're not just a 2D static image. And so when we're working, when we're trying to treat them, we're treating them in the realm of a 3D existence. And in the old days, we would, first of all, when it came to imaging, everything we did was static. We couldn't really see where the condyles, we could take let's say a Ceph or even do a CT scan with the condyles in a fixed position, in centric or whatever you decided, was going to be your imaging position. But you had no sense of the actual function. With the SICAT function and the jaw motion tracker, to actually be able to see objectively what's going on in the joints, which are the joints moving evenly and equally. Is there, are we going past the eminence when we open? Gives us a lot of information as far as what's going on in the tissues in the joint and behind the joint. And then when it comes to treatment, we can actually now, instead of just making an appliance that is sort of arbitrary, we can actually see where the condyles are going to see. We can design our appliance for the patient to be in the optimal position, the optimal relationship, and we can make modifications. So let's say we have the patient at a certain opening and we have the joints in one position, and we find that that's not helping the patient or it's making him worse. We can go back and very easily, without having to get another data set, modify the position, have a new guide made or new appliance made, and see how that works for them.
And when you're saying appliance, and first of all, I want to know how is the fit of the appliance. Number two is, what does that appliance do as far as correcting the actual, let's say TMJ in this particular case? How does that happen to correct it?
Well, as far as the fit, when we're talking digital versus analog, it's incredible how much more accurate digital impressioning, digital manufacturing is compared to the old way that we learned in school, where you've got an impression that has a coefficient of expansion. You can have artifacts, blebs, bubbles, and then you pour up the model. The stone has a coefficient of expansion. You can also get defects in the model. Pouring up or manufacturing an acrylic splint that has the same issues that occur, and you hope that all those different variances will even each other out or negate each other so that you get an appliance that fits well. Digital, it's micron per micron,
Wow.
absolutely accurate. You don't get that expansion or contraction, extremely accurate fit. In addition, we're including the occlusion and the function in our data. So when we make the appliance, it's not on a static articulator. It's basically on a functional, real-life 3D virtual articulator. And so we can set the occlusion in it however we prescribe. And I'm finding that when I get the appliances, the amount of adjustment I have to do on them compared to what I was used to is night and day. Maybe a couple little spots and that's it. Now, as far as how they actually function, there's a lot of controversy and a lot of theories. The way that I use a splint, and I'm just a dumb surgeon, so I don't spend hours and hours and weeks and months reading all the TMJ journals, but I just know from my clinical experience and what I know from surgery is that what causes a lot of patients' problems is clenching and bruxism at night. And if you can get them, to stop bruxing by opening up their bite a little bit so they can't generate that bite force at night, and so that reflexively with that change in vertical dimension, that clenching is inhibited, and also allow the joints to go into the most relaxed position as opposed to being forced into the glenoid fossa, those will all lead to improvement. You're de-stressing the joint in addition to anti-inflammatory medications, sometimes cortisone injections, arthrocentesis, try to avoid surgery as much as possible. So, and there's all kinds of other appliances, the NTI, and all kinds of functional appliances, which I don't get into, but I've had great success with the SICAT functional appliance.
What has been your experience in this thing?
Okay, pues the most easy way to say how is the fit is to show it.
Oh, wow.
I wear one. I'm a patient. I've been with this project for about 3 years. This is the only way that I can recapture my disc in position, in a physiological position. My teeth, they don't fit anymore. My headaches, my cervical issues, my discomfort. We have different kind of appliance. I design a prototype, the one that fits my needs, that has anatomy, so the body and the brain can recognize that position, because if you get to a room and it's just tables, your brain cannot connect that that's made it to be seated. Excuse me, that need this on.
Sure.
And then, but if you go to a room and you have chairs, you will see it, because your brain recognizes that. So the same principle I apply to the occlusion. Some people use appliances that they flat, so the brain eventually can get a little confused. Where I gonna sit? Where is gonna be my position? Fit-wise, an occlusion setup in this quality, when you have cause-fossa relationship, is really predictable, because if you took a really physiological aspects into the patient movements and you find what I call the sweet point, independent of any philosophy of occlusion, basic in common sense factors, because this machine records life, records everything, how you function, and if you can capture that point and stabilize that appliance in that point that is really close to where you rest and you create function, is going to be efficient. It's a similar example that I can say. If I live in Miami, but I work in Orlando, I'm going to need to be traveling too far, back and forth, what depends more energy on mine. So we try to put the bite really close to where we rest. So the reaction to start function is quick. It's less spend of energy. It's less guessing or less accommodation factors, because occlusion is not just the teeth together. We have the skull that is attached to the cervical spine, and the cervical spine is the one that domains where we're going to place that articulator, let's call. A big subject that I want to mention is we have the unique articulator in the world, and recapturing you in function with all your anatomical features that never, ever any mechanical articulator can reproduce. Even though if we try to collect information for this fantastic machine and we try to put it in an articulator that is mechanical, you lower in the resolution of the information to an 95%. It's like you have a high definition plasma and you put the cheapest core ever.
Right.
So the information that is going to get to the other side, it's going to be poor, and we're losing all this beauty about this technology.
Well, that's what that was my very next question, is how do you send the data to the SICAT?
everything is made in a way that we try to be the less invasive possible. Many of the procedures, you can have a good position, but using the time that you're trying to record by hand, that relationship can change everything. Here, you can see all the data and jump between different conditions and functions in the patient and say, this is my sweet point for this case. And then after that you mark that target, you just click a button, and that will say what is going to be your treatment position.
Right.
That file will go with the digital impressions that we already have set up, so it's not even need to have more impressions. Those impressions we will go to SICAT. They will have the model sprint, and based on that, the XYZ relationship, when we stop that by, the computers will recognize that, so they can make the splint fit in that needs without no need to invade the patient's mouth with the chance that it's a human error.
Wow.
So it's pretty consistent.
That's amazing to me.
All we need to do once we've determined our treatment position is essentially push a couple buttons. The data goes to SICAT, and a week later we get this appliance back that goes in without adjustment or minimal adjustment, fits the patient beautifully, and will hopefully get them, starting to feel better. And we think about the workflow in the old days and everything we had to go through with getting physical impressions and getting different type of bites, and how do we set the articulator, and fully adjustable, non-adjustable, what do you send to the lab, and all that is taken out. I mean, you've got, as you said, the finest articulator that is known to man is that virtual articulator in the SICAT Function software, because it's your actual patient. All the parameters are that patient's parameters. You don't have to set anything mechanical. Mechanical is great, but natural, there's nothing better than the human machine.
Well, something tells me, I'm going to go out on a limb here, that we could talk about this all day long. I mean, would you say, Dr. Reznick, Dr. Vasquez, thank you. We've got other people hanging on, but this is fascinating to me, especially a guy who suffers TMJ. So thank you.
And it's only going to get better and more sophisticated and more powerful as time goes on.
We just need more people engaged to use it, because we have too many machines that is sitting most into somewhere in the office. We need to be able to motivate the people. We need more people engaged to learn how the body works. And you play a little bit with that. And then we'll see how much we're going to learn. Maybe you don't need to read that many books or listen to many people. Find the questions and the answers yourself, seeing how that really body works under different conditions in different human beings.
Thank you so much, guys.
Thank you so much.
Hang around. We've got more SIROWORLD 2016 right after this.